USMLE style question. A 17-year-old male presents for a sports physical before joining his high school soccer team. He has no prior medical conditions and denies chest pain, dizziness, or syncope. His father died suddenly at age 40 while playing basketball. On physical examination, blood pressure 120 70 millimeter per gram, heart rate 72 BPM. Cardiac exam. A harsh systolic murmur is heard at the left lower sternal border, which increases with Valsalva and standing, but decreases with squatting. Which of the following is the most likely diagnosis? A. Aortic stenosis. B. Hypertrophic obstructive cardiomyopathy, HOCM. C. Mitral valve prolapse. D. Ventricular septal defect, VSD. E. Pulmonary stenosis. Answer and explanation. Correct answer B. Hypertrophic obstructive cardiomyopathy, HOCM. This young patient with a family history of sudden cardiac death, SCD, and a murmur that increases with Valsalva and standing most likely has hypertrophic obstructive cardiomyopathy, HOCM, an autosomal dominant condition caused by mutations in sarcomere genes, MYH7, MYBC3. Key features of HOCM: pathophysiology, asymmetric septal hypertrophy, outflow tract obstruction, syncope, or sudden death. Dynamic murmur due to systolic anterior motion, SAM, of the mitral valve, worsening obstruction. Murmur characteristics: harsh crescendo-decrescendo systolic murmur at the left lower sternal border, similar to aortic stenosis. Increases with Valsalva standing. Preload worsens obstruction. Decreases with squatting hand grip. Preload, afterload reduces obstruction. Diagnosis: echocardiogram, asymmetric septal hypertrophy, LV outflow obstruction. Management: beta blockers or non-dihydropyridine calcium channel blockers, verapamil, diltiazem, to reduce HR and contractility. Implantable cardioverter defibrillator, ICD, for high-risk patients. Avoid sports and dehydration. Reduce sudden cardiac death risk. Why not the other options? A. Aortic stenosis. Similar murmur, but it radiates to the carotids and increases with squatting. C. Mitral valve prolapse. Click and murmur move earlier with Valsalva, but does not cause LV obstruction. D. Ventricular septal defect, VSD. Holosystolic murmur at left lower sternal border with a palpable thrill. E. Pulmonary stenosis. Murmur heard at left upper sternal border, often with a wide split S2.